Do you know what your diastolic blood pressure tells you about your health? When we hear about blood pressure, we often focus on the top number, the systolic pressure. But let's not forget about the unsung hero, the diastolic blood pressure, the lower number in a blood pressure reading. This represents the pressure in your arteries when your heart is resting between beats. It's a tale of how well your arteries relax and refill with blood after your heart has contracted. The normal diastolic pressure should be less than 80 millimeters of mercury. Now, if it's 80 or higher, we're talking about diastolic hypertension. This isn't just a fancy term. It's a warning signal for potential heart disease, stroke, and other health concerns. It's crucial to understand and monitor your diastolic pressure because it plays a vital role in your overall health. If your diastolic blood pressure is 80 millimeters of mercury or higher, it's time to take notice. So what happens if your diastolic blood pressure is always high? The implications can be quite alarming. One of the major risks is the damage to your heart valves. High diastolic blood pressure can cause your arteries to stiffen, forcing your heart to pump harder. The extra effort thickens your heart muscle, which could lead to valve damage over time. Another serious concern is diastolic heart failure. This condition arises when high diastolic blood pressure prevents your heart from filling up properly with blood. The lower chambers of your heart, known as the ventricles, need to relax and refill after each contraction. But when diastolic blood pressure is high, this relaxation phase is hindered, and your heart can't pump out sufficient blood to meet your body's needs. In essence, high diastolic blood pressure pushes your heart to work overtime, straining it and potentially leading to severe health issues. High diastolic blood pressure can push your heart to its limits and beyond. Worried about high diastolic blood pressure? Let's explore some solutions. Just like keeping a car in good shape requires regular maintenance, so too does your heart. A few lifestyle tweaks can go a long way in keeping that diastolic number in check. Weight loss, for instance, can have a significant impact. Shedding even a few pounds can lower your blood pressure. Next, let's talk about your diet. Opting for heart-healthy foods, low in sodium and high in potassium, can help maintain a healthy blood pressure. Regular exercise is another key player. Whether it's walking, cycling, or dancing, find an activity you enjoy and stick with it. And if you're a smoker, quitting can dramatically improve your heart health. Lastly, don't forget to consult with your doctor. They can provide personalized advice and may prescribe medication if necessary. Remember, a healthy heart starts with a healthy diastolic blood pressure.